10 high-demand nursing specialties. Don't forget to click the like button and subscribe to our channel if you like to see more content like this. The future demand of nursing specialties is an important factor for prospective nurses to consider. After passing your NCLEX exam successfully, it will be time to focus on your future career as a nurse and the field you may want to settle into. Here are 10 high-demand nursing specialties you may want to consider after you finish nursing school. Number 1. Critical care nurse. Critical care nurses work in intensive or critical care units and provide close monitoring and treatment to patients with complex acute illnesses. Job responsibilities. Critical care nurses integrate technology and medical equipment to provide and maintain life support, administer medications and blood products, provide wound care, conduct frequent assessments of patient vital signs, blood chemistry and blood gases, and intervene accordingly. Critical care nurses can make from $70,000 to $90,000 in salary depending upon the location. If you work extremely well under pressure, like close collaboration with other specialties, want autonomy, and you excel at critical thinking, then critical care nursing might be the specialty for you. Number 2. Dialysis nurse. Patients with end-stage renal disease and renal failure require hemodialysis to filter their blood and regulate their hemodynamics. Dialysis nurses provide acute, chronic, and peritoneal dialysis. They administer continuous renal replacement therapy and support kidney transplants. Job responsibilities. Dialysis nurses operate dialysis machines, clean and transport access, capture frequent vital signs, administer blood products and medications during dialysis. They are also a good source of education for diabetic patients. Dialysis nurses can make from $70,000 to $90,000 in salary depending upon the location. Number 3. Nurse practitioner. Nurse practitioners provide primary and specialty care through specific roles to various patient populations. Nurse practitioners consult closely with medical doctors when giving medical care to patients. Job responsibilities. Nurse practitioners assess, diagnose, manage patient problems, order tests, and prescribe medications. Nurse practitioners can make up to $105,000 in salary depending upon the location. If you like pursuing an advanced nursing education, increased clinical responsibility, and prescribing privileges, then being a nurse practitioner might be the specialty for you. Number 4. Informatics nursing. The role of a nurse in informatics works to integrate data to support clinical decision-making and evidence-based practice for healthcare providers. Most who enter this field have backgrounds in computer or information science. Job responsibilities. Nursing informaticists analyze clinical statistics, track the success of quality initiatives, write policies, and manage projects. They can earn around the $106,000 range depending on your location in the country. If you like a non-clinical role, extrapolating data, and have passion for technology, then informatics nursing might be the specialty for you. Number 5. Nurse anesthetist. Nurse anesthetists provide anesthesia and care for patients throughout surgical, diagnostic, and during therapeutic procedures. Job responsibilities. Nurse anesthetists conduct pre-surgical assessments and screenings, titrate anesthesia and other medications intraoperatively, and perform frequent assessments of vital signs. Salaries for a nurse anesthetist can be around $164,000 depending on your location in the country. If you have excellent critical thinking and assessment skills, an innate attention to detail, with a love for critical care or the operating room environment, then being a nurse anesthetist might be the specialty for you. Number 6. Trauma nurse. Trauma nurses provide care to patients with life-threatening injuries when they arrive at the emergency department. They stabilize patients for transfer to surgery, imaging, and other intensive care or critical care units. Job responsibilities. Trauma nurses conduct primary and secondary surveys, obtain vital signs, attain and perform assessments, intravenous access, administer medication and blood products, as well as assist with wound care and splinting. Trauma nurses can make and even surpass $96,000 per year salary depending upon location. Number 7. Travel nurse. Travel nurses, or travelers, are registered nurses who work temporary assignments ranging from a few weeks up to 6 months or more. Job responsibilities. The clinical responsibilities usually depend on the nursing specialty selected. Travelers must furnish documentation verifying education, vaccination, and other clinical certifications. Travel nurses that travel between different states must also apply for licensure endorsement in each state where they will be working. Travel nursing can be extremely lucrative. Some travel nurses can make from $2,500 to $5,000 per week depending upon the location and specialty. If you are an experienced nurse who works well with people, adapts easily to change, can hit the ground running, and has a thirst for travel, then travel nursing might be the specialty for you. Number 8. Oncology nurse. Oncology nurses are dedicated to various aspects of cancer care, including prevention and early detection, secondary and tertiary care of patients and families, and care of survivors. Oncology nurses work as partners with oncologists and other cancer care providers in the complex care of patients with cancer. Job responsibilities. Oncology nurses administer chemotherapy and manage side effects related to chemotherapy, manage side effects of radiation, provide education and emotional support to patients and their families. Oncology nurses can make on average between $35 to $47 per hour depending upon location. If you like delivering compassionate care at a time when patients are most vulnerable, knowing your practice directly impacts the research and development of new drugs as you implement research protocols, then oncology nursing might be the specialty for you. Number 9. Pediatric nurse. Pediatric nurses help children, youth, and their families across the health continuum, including health promotion, illness management, and health restoration. Job responsibilities. Pediatric nurses perform physical assessments, measure vital signs, and administer medications to children. They provide education to children and their parents and also caregivers. Pediatric nurses can earn $56,000 per year or more depending upon the location. If you have a special ability to connect with children, are a therapeutic communicator, and can readily provide age-appropriate education to pediatric patients and their families, then pediatric nursing might be the specialty for you. Number 10. Geriatric nurse. Advances in medicines and technology are allowing us to witness an increase in life expectancy in older adults. More are living with chronic conditions, physical and cognitive limitations, and functional disabilities. Nurses in this specialty cater to this population of people. Job responsibilities. Gerontology nurses manage the nursing care of older adults with a range of complex conditions. Examples would be tube feedings, wound care, peritoneal dialysis, dementia, and other chronic conditions. Gerontology nurses can earn $70,000 per year in salary or more depending upon location. If you love working with older patients and are passionate about holistic nursing, behavioral health, and wound care, then geriatric nursing might be the specialty for you. We have previewed a selection of nursing specialties forecasted to be in high demand in the future. Keep in mind, there remain many nursing specialties that offer promising opportunities. The ones we listed just happen to be the most popular and in demand. With an honest self-assessment and planning, you can chart your own professional nursing career with one of these in-demand specialties.